So this is a little talk about how I'd approach pathology as a first year now with what I know from experience in terms of how you'd put together a curriculum of what to study, and then I'll show you an example of what I'd do. So there's no official curriculum for pathology. You can kind of take the incidental way where you read about each thing as you come across it. Or you can get a book and look at the table of contents to use as a kind of substitute curriculum. So I tried that with various books, and then this is kind of the best of that kind of approach if you want to go through things methodically, which I think is a good idea to do. I think a good concept is to think about doing laps of the organ systems in the way that you do in med school. So in the first kind of 18 months, you kind of do all of the organ systems, and then throughout the rest of medical school, you kind of do one or two more laps with greater depth. So I think it's good with pathology in the first, 3 to 6 months, aiming to do one lap of the organ systems at a superficial level, and then you've got a grounding in each one, and then you can do each lap in greater depth. So in terms of goals, the kind of first lap, the first sort of milestone in terms of histology and being able to just show that you're progressing as a pathologist at the microscope is when someone puts down a piece of prostate on the microscope to just know that that's prostate. Where we practice in Australia, that's generally considered a sign that you're doing okay in your first year, if you can do that. And then there are these classic entities that people love to show first years, like a basal cell carcinoma or Schwannoma or a pleomorphic adenoma, etc. You'll learn these pretty much no matter what, because you'll get shown so many and you'll get them wrong in public and you'll remember what they are. But you can actually learn them in advance and then skip the getting it wrong in public if you like to do it that way. And then so you can do that, and then that's kind of your first lap, and I should also add there that you kind of know the basic histology of each type of tissue. And then with that complete, I'd suggest doing a second lap where you learn the basics of IHC. So you can ignore that the first time around and just look at H and E. And then that takes a month or two. And then go on a third lap where you can go in greater depth in terms of less common entities, and also start learning how we sort out things that look similar, like differential diagnosis, etc., etc. So the ideal text to do this, I think, is a combination of Kurt's notes and expert path. What you want is something that covers both the medical and the neoplastic entities. So things like the WHO Blue Books only cover tumours, and so it's quite hard to find things that cover all the non-tumoral stuff, but that's really obviously important. So in skin, you need to know some common rashes, as well as recognizing skin tumours. And in terms of the text, particularly at first year, you want the text with the level of detail that's just basic, like no extraneous detail that you don't really want to sift through, and like really obvious emphasis of like the so-called high yield item, the key things you need to know. And so Kurt's Notes is this free online set of PDFs that is the best match for this. It covers medical and surgical entities, and it's very basic, and things that you really need to know are emboldened and underlined, so it's super clear. The photos are like so-so, but I think it's hard to appreciate when you start out, but having the best photos to study from makes a big difference later on. Kind of need experience to see why, but Expert Path is unrivaled in terms of its photo quality. So I would use the photos in my notes from Expert Path, and then where things require a bit of explanation, like etiology, whether something's virally driven or like kind of a bit of a why, not just what, then you can usually find that in bullet point form in a simple way in Expert Path. So I will do a bit of an example. Let's say, so one more thing to mention with Kurt's notes. There's a lot of entities in there, so in the first lap you'd only do it for select entities, and I'll put up or send a list of what I think would be the select entities to learn for each system in your first lap, if you want to give this a go. So, Kurt's notes. So say you went with skin and epithelial tumours, and one of the things you'd just kind of want to know, because it's just such a common thing, is basal cell carcinoma. So if I was in the position of studying it, I'd get to it in Kurt's notes and say, this is one that I need to learn. And you can see here that you've got this really strong emphasis on the fact that you recognize it because it's basaloid. The cells palisade, which means form like a picket fence kind of thing around the side. And then it makes clefts between the tumor and the surrounding stroma, which you can't see very well in this photo, but that's a giveaway. So you want to know, not only be able to recognize it, just look at it and say that's a BCC, but you also want to be able to articulate from memory the three features or those features. Having that ability to articulate the features is something people kind of overlook, and they just rely on visual recognition without actually being able to articulate the features. When you can articulate the features, it just gives you a lot more flexibility in recognizing what something is when it doesn't look exactly like the picture you're familiar with. So what I would do would be open Anki, and I've made it already. Let's pretend I'd never made this card you can see in the background. Whoopsie. So let's say just using the basic closed note type. I usually put what type of organ system you're in, just so you're not trying to work that out each time. It just makes life easier. And then I put diagnosis in shorthand, and it'll be basal cell carcinoma. And then I try to make all of the information into just one-word answers. So basaloid cells with increased NC ratio. I just say cell color, basaloid. Nest with peripheral palisading, I'd say peripheral. I'd say palisading would be the answer. And something for the cleft, I would say stroma, side, tumor, feature, cleft. The idea is just to kind of write the prompt so that there's just a one word to answer. And what we need also for this note is going to be a good photo of a basal cell carcinoma for our kind of diagnostic challenge. So let's go to Expert Path where we get the best photos. Find the skin one, and then you got some clinical ones. So usually the first microscopic one is the one with all of the classic features. In this case, it's really the second one that has all of the classic features. And there's no sort of only you kind of need a bit of experience to know. You might learn one that isn't actually representative doing this, but that's just what you have to learn with experience, whereas this one's kind of more typically representative. And so you can just see like the level of like resolution of the photo is higher in these expert path photos, and then they also have matching arrows to the caption, which is super helpful, so you're not guessing at which bit's the cleft if you weren't sure. So I would snip that photo, and sometimes I might use like a low power and a high power one. I one's a micronodular type. You kind of want to have the conventional type. Anyway, one photo will do for this one. And so then you want to create like 4 flashcards for this. So as you'll hopefully know from previous video, each thing that you block out with this close tool will become its own question. So question 1, you'll have this photo and you have to diagnose that it's a basal cell carcinoma. And then you want to make each of those one words after the prompts a question. Not sure why these are all having the same number. That shouldn't happen. Mine's a bit buggy on this one. And so that's how we would make a little card for the basal cell carcinoma. And then once you've done that, add it. And let's find what it would look like. So it'd be something like that. So the first card would show us this picture, and there's the text as well if you kind of want to cheat a bit. And the question would be the diagnosis. It's basal cell carcinoma. And then the next card would be one of these ones. The cell color was basaloid, and the stroma at the edge was clefting, and the peripheral cell arrangement is palisading. Obviously, you can see the answers to the other ones while you're answering the other ones, and there's ways to work around that, but just to keep things simple, I've just made it in a simple way. So yeah, that's what you do. So you're, if we kind of go back to the goals, that's helping you recognize the sort of first year classic entity, not just getting familiar with that one image of it in the photo, but also just getting to the point where if you ask yourself, what are the features of basal cell carcinoma? You can easily say to yourself, oh, it's basaloid, it has peripheral palisading, and stromal cleft, the cleft beside it and between it and the stroma. And that'll sort of help you work out that something that looks a bit funny is actually most likely a basal cell carcinoma. And then I'd learn those common skin entities, and then while I was going through the skin, I'd also take it as a time to familiarize myself with normal skin histology, which normal histology and recognizing things that are just normal structures is often harder than recognizing pathology, because pathology is kind of obviously abnormal, whereas lots of bits of the skin you're not sure if it's just a normal structure or if it's like a really subtle tumor or something like that. So so expert path's also what I think is the best resource for learning normal histology too. So if you go skin, you'll see these articles on normal histology. This one's fetal skin, and you can't find the adult skin one, but it is in there. So sometimes I'll open up one that's kind of a neighbor of the article we want, and you can see you've got the I don't know what this thing's called up the top, but you can see here you've got the normal histology menu, so we can click on that normal histology. You've got adult histology, and you better find your way to the skin. And then you can see the skin one was actually called epidermis, and that's why we couldn't find it. And then what I'd do for each organ system is just learn anything that has an arrow in the photos is worth knowing. And there usually aren't that many photos. Like for the skin one, you got 1, 2, 3, 4, 5, 6, 7, before you start getting to some kind of weirder stuff. There's some normal variation, like that's what dark skin looks like, so you can just be familiar with that, so you don't, call melanoma in someone who's African or something like that. And then you start to see some of the abnormal ones, which you can look at for interest, but you don't need to memorize. So if you've got, 10 images there, and each one has 1 or 2 arrows, you just learn about 20 things. So maybe for this one, what have we got? You got the granular layer with orthokeratosis and loose collagen and small blood vessels. So if you know all of these things already, don't re-memorize something you already know. You can just skip it, obviously. But for something like this, assuming I didn't know the name of the granular layer, and you can see that's the white arrow, you can either do something like this, give myself a bit of an introduction so I know what I'm looking at. You can say like white arrow, granular layer, and then make that, or even just one word, make that the question. Or you could, I find that's annoying because then you've got to find the white arrow in the picture and it's kind of slow. You can actually just describe what it is, maybe just say layer directly beneath the stratum corneum or the keratin, whatever you want to say. And that way you don't have to find the arrow in the photo. And if you wanted to save the caption so you can read it with the caption after you've done the question, you could always just snip it with the caption and put that in your extra or remarks or whatever that thing happens to be called. And then when you look at it, what do we write? Corneum. This might be hard to find. Oh, there it is. You've got your question, but if you put something in extra, you can see it after you've answered the question if you want it there for reference. So on that first lap, I basically learn, it's probably going to be like 10 or 15, depending on the organ system, common organs and the normal histology of that tissue. So not only can you recognize it, you also know that the granular layer isn't, an infection in the skin, or you don't kind of jump at shadows. You kind of know the normal histology. And then the second lap I'll just talk briefly about. In terms of understanding the role of basic IHC stains, the best resource is this one. Can we get to the cover? There we go. This is this kind of, I think it was like a registrar handbook they used to just hand around, and it sort of had such a long life they actually published it as a real book. And if you go to chapter 1, immunostains, you've got these primers, and these are just awesome. They've got these real hokey diagrams, which makes it look a bit like it's not very good. But like this, the information in this table is absolute gold. So I just read some of the primers on cytokeratins. You kind of know when you're done. You just kind of read a few of them, and then you'll just kind of realize you're getting into stuff that you don't need. And that, for your second lap, gives you some familiarity with immunohistochemistry. And then when you get to the third lap, this is, you just kind of do the same process, but you sort of expand your net of entities from Kurt's notes into, you've probably learnt, I don't know, at this stage, if you've done the first lap, you will have learnt 5 or 10% of them, and then you might learn sort of 50 more % of them, or 60 more % of them, in terms of those entities. And then you'd want to start learning how you learn a differential diagnosis workup, which will probably be a subject for another video. So that's it. That's what I reckon would be how I'd go about it now with what I've learnt, what I think the best resources are. Let me know how that goes.